UK government scientists have warned further COVID-19 restrictions will be needed within days to stop hospitals being overwhelmed. It comes as the country records 10,000 positive Omicron cases.
The capital's hospitals in crisis, pushed to the brink by the surge of patients with Omicron and compounded by so many staff isolating with the virus.
We're incredibly concerned by the huge surge in the Omicron variant. Over the last 24 hours, we've had the largest number of new cases since this pandemic began, more than 26,000. Hospital admissions are going up, but also staff absences are going up by a massive level. So I've taken the decision, in consultation with our partners, to declare a major incident today.
The rest of the country is just days behind London. Documents considered by scientists on the SAGE committee on Thursday show Plan B won't hold back the tide. The true number of infections are running at hundreds of thousands of cases every day and still doubling every 2 days. That could double hospitalisations within the next fortnight and lead to well over 3,000 admissions a day at the peak of the wave in January, with a high risk of the NHS being overwhelmed.
My understanding is that senior scientists advising the government favour a circuit breaker, with extra restrictions being brought in that last for as long as it takes to give everyone a booster, and they would need to start almost immediately.
Admissions could be significantly reduced with measures similar to those in April, step 2 in the roadmap out of lockdown, when non-essential retail was open, but pubs and restaurants could only serve at tables outside, and indoor mixing with other households was banned.
The challenging thing is that a lot of the rise in hospitalizations is already baked in now, because the rise in cases we're seeing now is going to be the rise in hospitalizations in a week or two's time. So in a sense, the decisions we make won't come into effect in affecting hospitalizations until maybe about 2 weeks' time. So it's always this very tricky. We need to act quickly, but at the same time, we don't have full certainty about many things.
Just over 800,000 people got their booster in the latest daily figures, still well short of the Prime Minister's target of 1 million a day. Medical teams say motivation is high.
There's a race against the time, as you probably have seen the modelling. It is to protect the NHS, to protect the people feeling unwell and have a merry, nice Christmas safely at their own homes with their friends and family.
Some early evidence from South Africa suggests patients admitted to hospital with Omicron are less likely to need oxygen and they stay for a shorter period. But government advisers believe it is far better to prepare for the worst and scale back if reality turns out to be better than predicted. Otherwise, the fate of the NHS could be sealed before there is time to act. Thomas Moore, Sky News in Hillingdon, West London.